Diverticular disease and diverticulitis are related conditions affecting the digestive system, particularly the large intestine colon. They involve small bulging pouches, called diverticula, that form in the walls of the colon. These conditions are more common as people age, particularly after the age of 40. What is diverticular disease? Diverticular disease refers to the presence of diverticula in the colon that cause symptoms like pain or discomfort, but without infection or significant inflammation. It occurs when the diverticula small pouches in the digestive tract cause issues such as pain or changes in bowel habits. Diverticulosis. This term is used when diverticula are present but not causing symptoms. Most people with diverticulosis remain symptom-free. Diverticular disease. This occurs when the diverticula cause symptoms like abdominal pain, bloating, or changes in bowel movements. What is diverticulitis? Diverticulitis occurs when one or more of the diverticula become inflamed or infected. This condition can range from mild to severe and may sometimes lead to complications. Symptoms: diverticular disease, diverticulosis. Most people with diverticulosis don't have symptoms, but when they do, they may include abdominal pain, usually felt in the lower left side of the abdomen, bloating or gas, constipation or, less commonly, diarrhea. Diverticulitis. Symptoms of diverticulitis are more severe due to inflammation or infection. They may include severe abdominal pain, usually on the lower left side, though it can also affect other areas, fever and chills, nausea and vomiting, constipation or diarrhea, bloating and tenderness in the abdomen. In severe cases, there may be rectal bleeding or the formation of abscesses, pockets of pus. Causes and risk factors: diverticula form when weak spots in the colon's wall give way under pressure, causing small pouches to bulge out. Several factors can increase the risk of developing diverticular disease or diverticulitis. Aging. The risk increases with age, especially after 40. Low-fiber diet. A diet low in fiber can lead to constipation, which increases the pressure inside the colon, contributing to the formation of diverticula. Obesity. People who are overweight have a higher risk of developing diverticulitis. Lack of exercise. A sedentary lifestyle is associated with a higher risk. Smoking increases the risk of diverticulitis. Medications. Non-steroidal anti-inflammatory drugs and SARDs, steroids, and opioids are associated with an increased risk of diverticulitis. Diagnosis of diverticular disease or diverticulitis typically involves a combination of medical history, physical examination, and imaging tests, including physical examination. Doctors will assess the location and severity of abdominal pain and other symptoms. Blood tests, to check for signs of infection or inflammation, particularly if diverticulitis is suspected. CT scan, computed tomography. This is the most common imaging test used to confirm diverticulitis, as it can't show inflammation, infection, or complications like abscesses. Colonoscopy. This test may be performed to look directly at the inside of the colon, usually after the acute inflammation has subsided. X-rays or ultrasound, sometimes used to rule out other conditions or complications. Treatment: diverticular disease. Dietary changes. Increasing fiber intake through fruits, vegetables, and whole grains can help manage symptoms by promoting regular bowel movements and reducing the pressure in the colon. Staying hydrated and avoiding foods that trigger symptoms such as processed foods or those that cause gas may help. Medications. Fiber supplements, e.g., psyllium, to aid digestion. Pain relievers. Acetaminophen is often recommended, as NSAIDs may increase the risk of diverticulitis. Exercise. Regular physical activity promotes healthy digestion and helps reduce the risk of diverticulitis. Diverticulitis. Treatment for diverticulitis depends on the severity of the condition. Mild diverticulitis without complications. Antibiotics to treat infection, though in some cases, Mild cases of diverticulitis may not require antibiotics. Liquid or low-fiber diet. The temporary switch to a liquid diet allows the colon to heal. Gradually, patients can return to a normal diet, starting with low-fiber foods. Severe diverticulitis or complications, e.g., abscesses, perforation, or fistulas. Hospitalization may be necessary for intravenous antibiotics and fluids. Surgery, if complications such as a perforation hole in the colon, large abscess, fistula, abnormal connection between organs, or bowel obstruction occur, surgery may be required to remove the affected portion of the colon, partial colectomy. Complications of diverticulitis: abscess, a pocket of pus that forms in the colon. Perforation, a hole or tear in the colon wall that can lead to peritonitis, infection of the abdominal lining, a medical emergency. Fistula, an abnormal connection between the colon and other organs, such as the bladder or skin. Bowel obstruction, blockage of the colon due to swelling or scarring from repeated attacks of diverticulitis. Prevention: high-fiber diet. Eating more fiber, 20 to 35 grams per day, helps to keep stool soft and reduce pressure in the colon. Good sources of fiber include whole grains, fruits, vegetables, and legumes. Hydration. Drinking plenty of water can prevent constipation and strain on the colon. Regular exercise. Physical activity helps maintain regular bowel movements and reduces the risk of diverticular disease. Avoid smoking. Smoking is a risk factor for diverticulitis. Weight management. Maintaining a healthy weight can reduce the risk of diverticulitis. Conclusion: diverticular disease and diverticulitis are related but distinct conditions involving diverticula in the colon. While diverticular disease may cause mild symptoms like abdominal discomfort, diverticulitis involves inflammation or infection and can lead to more severe symptoms and complications. Managing these conditions typically involves a combination of dietary changes, medications, and, in severe cases, surgery. Maintaining a high-fiber diet, staying active, and avoiding risk factors like smoking can help prevent or manage these conditions.